Please welcome to the stage Kate Warren and Ken Gustavsen.
Thank you. Well, we are going to continue the discussion around health financing, taking a look at how venture capital can be used as a social investment tool. So I'm really delighted to be joined by Ken Gustavsen, who is the Managing Director of MSD Impact Venture Funds. So Ken, thank you so much for joining us today. And we were talking a little bit earlier, and you were saying 10, 20 years ago, we couldn't really be having this conversation. But since then, venture capital has really evolved, right? And really being able to be scalable for social impact. So can you talk a little bit about what has changed and why that is the case now?
Yeah, do I need this or are we good?
You can grab that, yeah.
Okay. Thanks, Kate. Good afternoon, everybody. So I think one reason I think that's true, that 10, 20 years ago we wouldn't have this conversation, is that there just wasn't the recognition of the opportunities that were steadily increasing over that period of time for the investable opportunities, especially in low and middle income countries, that might have at the time really lent themselves to primarily philanthropic or charitable solutions. But now, when you do have an ecosystem that can support sustainable enterprises that can grow, can generate a return for investors, that it just becomes more of a reality that the opportunity is there and the solutions can be much more sustainable than a philanthropic solution.
Yeah, and I think there's often this maybe misconception that there's a trade-off between investment opportunity and financial gains and returns and the social impact. And so is there a trade-off, and how do you see that balance?
I think there can be a trade-off. I think every sector is different, every geography is different. So there may be a trade-off, but there are also a lot of clever tools that are being put in place from a financial standpoint to address some of those trade-offs, things like different classes of capital and different ways to look at risk, different ways to look at the investment timeline that can address some of those risks. But at the same time, investing in these kinds of opportunities, there sometimes is a willingness to take a little bit of a trade-off if you're looking to tie in impact with financial return.
Yeah, you talk about risk, and I think there's often a challenge in assessing risk in low and middle income countries, and maybe a perception of increased risk that maybe is just unknowable risk. And so how do you go about measuring, evaluating that when you're thinking about your investments?
Yeah, so I think a lot of different ways, but ways to address risk is to diversify across geographies, diversify across time, and looking at different types of capital. A lot of times looking at investment funds, you might find a capital stack where you have some investors who really want to come in fully commercial and maximize their financial returns, and that's great. But in order to make that happen, you might find other investors who are willing to be catalytic and come in at a lower return rate and be willing to roll over any excess returns to the commercial investors. And that way it has the effect of being catalytic to crowd in more capital and also de-risk.
And so when we think about how you measuring the impact, so obviously there's the financial gains, that's a more straightforward measurement. How do you measure the social impact of your investments?
It can be different for every investment. What we do at MSD is we look at the common denominators, the number of people that are reached with innovative products and services for healthcare. And we simplify to that level because if we're invested in a clinic, it might be the number of people that come and use the clinic. If we're invested in an app to have a new payment mechanism for healthcare, the number of people who use the app. So you have a different thing that's being measured for each investment, and then try to standardize it across different investments. But I will say that impact measurement and management is an area of opportunity to look for ways to try to standardize and make it be more objective across different investments.
And can you share some examples of some of the success stories or some of the investments you've made and kind of where you've been able to see that social return?
Yeah, sure. So one investment we have is a company called MammoTest, which is a company that started in Argentina about 10 years ago doing mammography services and trying to offer mammographies in a way that was cheaper, and less expensive and more accurate than the standard of care. And so we invested in MammoTest about 4 years ago to help them expand out of Argentina into other markets. Since then, they've enjoyed some additional follow-on investments from some other recognizable names in the space. And as a result of our contributions and support, they've been able to expand into Mexico, entering into Brazil, very active in Spain even, from a language standpoint, they're able to do that. And they benefit about 100,000 patients a year. They have a evolving artificial intelligence digital image interpretation platform that helps them do what they need to do, exactly what they want it to do, cheaper, more quickly, and more accurate than the standard of care. And it's having a great impact, both in the public and private sectors.
So in the past couple of days, in a lot of our discussions, we've been talking about how to kind of reframe what are often seen as challenges as opportunities. And so where do you see the opportunities for more venture capital to invest in health specifically, and maybe in overall social progress more broadly?
So I think one opportunity is looking at it not simply as impact investing, but just looking at it as venture capital investing. So 10 or 20 years ago, we wouldn't have really been having this conversation. For certain reasons, in 10 or 20 years from now, we might not be having this conversation because we might not be talking about impact investing. It's just venture capital. And so I think evidence of that is we are seeing increasingly that when we invest, we might be investing alongside not just impact investors, but investors, venture capital investors who say, this is an opportunity. And it's the social impact and the financial return are not seen as competing, but they're mutually reinforcing. And so I think that is a way to look at the opportunity. It's just an investment opportunity. And yeah, there's impact associated with it, but it shouldn't be seen as a constraint.
And so we're here in the sidelines of the World Bank and IMF annual meetings, and we have a lot of finance ministers and health ministers and governments represented here. Where do you see the role of government and the public sector, and where do you see maybe the opportunities and the challenges to be able to leverage venture capital as they're looking to increase investments in their countries?
Yeah. I think it's a great opportunity. I think that there are a lot of synergies between what the public sector wants to provide, and it can still provide it, but can it provide those products and services through private channels? The public sector doesn't have to do everything by itself. And so can it contract out? Can it partner with? And how can those two branches work together?
Yeah. And I talk about just kind of ensuring each investment fits into a broader ecosystem, right? So you're looking at your individual investments, and I'm sure some that are shorter term, longer term, and how do you think about it fitting into that overall ecosystem within health system strengthening?
Yeah, I think the shorter and the time frame is a very important perspective. People talk about patient capital, and you have to have that longer term perspective. At the same time, it's not forever. And so looking at an investment with a 5 to 10 year horizon helps you think that, okay, this investee, whatever it is, needs to come up with a way to be sustainable and to realize that it won't be having investment capital flowing in the same way that a charitable recipient might not be able to have charitable sources of funding forever. So I think that's the way to look at it over time.
Yeah, and when you look across your portfolio and just kind of the broader impact investing landscape, what are some of the biggest lessons you've learned about, what actually works that maybe others could be learning from?
So a couple of things. I think one is just for any investing, thinking of diversification and diversify across the investment vehicles that you invest in, diversify across geographies, diversify over time, and that can help balance risk. It can help identify opportunity. I think not going it alone, looking at who you can invest alongside of, who can you learn from, especially if you're just getting into the space. How can you offer benefits to your portfolio investees beyond just writing a check? So can you provide human resource benefits? Can you provide networking opportunities. And can you even look at intra-portfolio opportunities by making introductions between this portfolio company and that portfolio company? Might not necessarily be benefiting you as the investor directly, but can strengthen the portfolio and the work that they need to do.
So I think there's a lot of really exciting technology in the healthcare space, and even we talk about AI, and I think a lot of people are very nervous about AI, but the one use case that seems to be maybe more exciting is thinking about in the healthcare space. And so as you're thinking about the opportunities and the kinds of investments and projects, what do you think the role of technology and maybe even AI specifically, and what kind of opportunities that might provide?
So in general, no surprise, technology is really helpful in leapfrogging from current solutions to future solutions, and maybe skipping over some intermediary steps, especially in a resource-constrained market where they can go from point A to point Z rather than having to go through intermediary steps that we might have had to do in a higher income country. So it can just help accelerate the change that they need to see. I think that in evaluating investment opportunities, we have some platforms that we can use to analyze pipeline opportunities using AI, which is just kind of cool, and it accelerates the ability to do that analysis. And then in terms of the actual technology solutions themselves, where we're seeing a lot of it, and there are many other areas, but for example, digital image interpretation using AI that can not necessarily replace a radiologist, for example, but accelerate and enhance what a radiologist would do and triage certain images that might not have to be looked at, but then make sure that if you need human intervention, you can pinpoint those ones that need the human eye.
Yeah. So when you think about venture capital is still a small portion of the overall health financing landscape, but what do you think needs to be done to scale it more and to make venture capital be able to drive more progress in healthcare outcomes?
I think just an open look at the opportunity. As we were saying before, looking at it not necessarily as impact investing, but just looking at it as venture investing and seeing where those opportunities are. There have been several funds that we've been associated with that are on a big growth trajectory, and maybe had a first fund a few years ago that was only $30, $40, $50 million, but now we're raising funds in the $400, $500, $600 million because they're bringing in more traditional venture capitalists who are seeing that opportunity.
Yeah, so I think, what do you think it would take for more investors to see it this way? What are the roadblocks right now?
We should definitely have more conversations like this, with groups like this, and I think maybe a little bit of a mindset shift in looking for commercially sustainable solutions that can require upfront funding from a venture capital standpoint, but then realize that they can be sustainable after that. And from a development standpoint, looking at those sorts of solutions more closely.
So, and the people in this room and a lot of our audience is tuning in online, they're either working for maybe an NGO or a government or another private sector company. How would you want them to think about the role of venture capital in being able to further enable the work they're doing from that kind of diverse landscape perspective?
I would say just make sure it's part of the spectrum of tools that you would see at your disposal. I think that, again, getting back to the 10 or 20 years ago, you might not have seen venture capital as being a tool that could be deployed to address some of the global development issues that are out there. Now it is. It's not necessarily the solution for everything, nor is philanthropy the solution for everything, but how can they work together?
Yeah, and so, I think sometimes there's this, different language that different groups speak and maybe get a little afraid of the venture capital maybe sounds, out of someone's depth if they're not working in that space. So just as you think about those two worlds talking to each other, if you're in the global health space, what would you say as far as thinking about how venture capital can be part of their vocabulary and just how those two worlds could better communicate and understand each other?
I mean, I would think of it as financially supporting an enterprise in a way that will eventually lead to it being self-sustaining. And contrasting that with philanthropy that might not necessarily have that self-sustaining part as the end game.
Yeah. Right. Well, Ken, Thank you so much. I'm sure you gave our audience a lot to think about, the role of venture capital, and hopefully in 10 years, we'll just be talking about venture capital, right? And thank you to MSD for being a partner for us.
Thanks, Kate.
Yeah, thanks, Kate.